Jefferson Center, we've been here for 55 years.
The center is 55 years old. Community mental health is really 50 years old. 50 years ago, this year, John F. Kennedy, one of the last piece of legislation that he signed before his assassination, signed the Community Mental Health Centers Act. And Jefferson Center was already 5 years old and had already been serving the community for 5 years.
I think our youngest client is 2, our oldest is 90.
The Jefferson Center is there for day-to-day care for our kids, day-to-day care for our staff, as well as focus on crisis, tragedy, and the immediate needs that we have.
We do a lot of public education through our website. We try to disseminate information. We have an array of services for people. We have wellness services for people that can teach basic skills about stress management, managing anxiety, health classes, wellness classes on managing all kinds of aspects of parenting and transitions in life. We offer community education. We have a program called Mental Health First Aid, where we go out, provide training to people in the community who may run into others who are having emotional issues.
The treatments for mental illness are as effective as the treatments for physical health, and people learn that in mental health first aid. They learn that they don't need to be afraid, and they learn that they can help their loved ones, their friends, to get the care that will make a difference for them.
It helps them know how to respond, how to direct people to the services that they need.
My husband took the class and he loved it. He learned a lot from the class and has suggested it to his friends.
And if there's a community crisis of some sort, a natural disaster, even a human-caused disaster where people have been traumatized, we mobilize our own resources here at Jefferson Center to go out and see if we can be of some assistance to our community. We have a lot of wildfires. It's just a little over a year ago, the Lower North Fork fire in Conifer, Colorado. It was a fire that destroyed 25 homes, claimed 3 lives, so it was pretty devastating to that community. It's a time of tremendous fear and uncertainty. People usually are given very little time to evacuate, and they're pushed into some kind of a evacuation center where they don't know anybody. They're away from their homes, away from their neighbors, their community, their pets, their friends. And it's a time of great confusion and disorientation. People want to know what's happening to my home. We try to provide some support, help them get accurate information. We'll do things to help them cope with the situation they're in. That's where we start. There are people that did what they needed to do at the time to survive and be safe. The adrenaline starts to rush and people just react and do what they need to do. But it may be months later when they get back home and something triggers a memory of what they went through, that all of a sudden this ocean of emotion comes washing over them, and they just need to talk about what they've been through. Why was I lucky when my best friend, my neighbor, lost his home, my house was spared? How is that? And we can be available at times like that. A young girl was abducted and killed. This kind of disaster has a different sort of impact than a natural disaster like a fire or a flood, where it feels like it's out of our control.
We're used to finding children, and we didn't find her.
As adults, there's nothing more important to us than protecting our kids.
We had immediate response from the Jefferson Center. Where we saw the result was, of course, immediately with our teachers. And I think that one of the things you always have to do with parents and with staff is help them know how to answer questions, what are the right things to say, so that when children ask questions, they weren't left wondering how to respond.
I did reach one woman who had met with a counselor, and she talked about what a huge difference it had made to be able to sit down with this counselor, talk with her children, and talk about what they were feeling, talk about the fears they were facing. They got some strategies for what they could do when they went home to feel safer. And she said it was so helpful to have that information. And she was so grateful that she came in and that this service was provided for her. She felt like it made a big difference in her family.
Without Jefferson Center, we would not be as strong as a school district, as a county, and as a community.
The people that do this work have a passion for it. They're really committed to wanting to be helpful. Again, because it's our own community, we feel these things too. We're not immune to the impact of the death of a child or the impact of 25 homes being burned. It's not something you can handle in a week and put a nice bow on it and say we're done. It goes on for a long period of time. And every time another disaster hits, it may bring back memories for the survivors of the earlier disaster. But often people aren't aware that we have that service available until something happens.
And if we can save families those years of searching for an answer because people in the community understand that the center's here and the center's available, why, I think that's a great thing that we can do, but it's a great thing that the community can do for us and for the rest of the community in terms of letting people know that that service is there.
We're going to be here for the long haul.
So thank you, Jefferson Center. We need you.